Adoption is really a reflection of lack of control over other parts of your life. And almost every mother that I interviewed, if you had given her spaces of resources and support that she could have relied on later in her pregnancy, she would have taken those options rather than relinquishing. They would love a way to parent, right? That's what they are seeking out. That's why they've continued these pregnancies. They feel very bonded to their pregnancies. They feel a high level of obligation to their children. And that is why a reproductive justice frame really requires us thinking about how we can make parenting possible for these women. Because it's not about forcing them to mother. It's about whether or not people actually have the option of parenting.
Hi, Jonas.
Hey, Bev.
What are we up to today?
Well, this is Outlawed.
Yeah, and who are we?
Just a couple of OBGYNs, professional OBGYNs, amateur podcasters. When I was pulling into the parking lot of the abortion clinic the other day, the protesters were sort of leaning toward my car and saying, just give the baby up for adoption.
How did you respond?
Well, I didn't respond, and I didn't make eye contact, which is what you're supposed to do. But it does make you think about why it's important to examine the systems for adoption that exist in the United States.
Right. I think one thing that we've talked about a lot is that it's not a simple alternative for people if they're unable to access abortion. Well, just relinquish your child.
So it does bring up this question about what is the experience for people who are making the choice potentially between abortion, adoption, or parenting when they don't feel that they have the resources to parent in that moment. As with many other issues, fortunately, the University of California, San Francisco has an answer for that.
What is ANSIRH, Jonas?
ANSIRH is Advancing New Standards for Reproductive Health. Today we're talking with Gretchen Sisson, who's a sociologist and an expert on adoption, and she wrote the book Relinquished: The Politics of Adoption and the Privilege of American Motherhood.
Honestly, I didn't know a ton about adoption until I heard Gretchen speak and then read her book, and it's incredibly eye-opening when you start to hear the stories of the birth mothers.
The stories that we talk about mainly in this episode are from the American private adoption system, though others are portrayed in the book, and she does talk about other systems.
If we're thinking about this from a reproductive justice lens, our systems in the U.S. for private adoption don't necessarily meet what we would consider to be our standard for a reproductive justice-focused system. A lot of these private adoption systems kind of pull people in with this idealized view of adoption and don't necessarily consider the circumstances of the birth mother that may be relinquishing their child. And so if people are sort of pushed into the corner because of their economic circumstances, that's not reproductive justice at all.
If you are advocating for adoption, what are the things that we need to do to improve this system, to improve life for people who do relinquish, to make sure that the children of adoption are able to live healthy lives and have a relationship with their birth mother if they want to, and that's their desire or not, and also that adoptive parents can feel good about the thing that they're doing. You know, we both have adopted people in our lives who we love and have had happy stories. We have had patients, too, who adoption has helped them start a family if they're facing infertilities. So we want to make sure that the systems promote ethical practices and treat each of those parties in the way that they deserve to be treated.
My name is Gretchen Sisson. I'm a sociologist with Advancing New Standards in Reproductive Health at the University of California, San Francisco. I kind of ended up in sociology a little bit through the back door because I was really studying gender. So my majors in undergrad were psychology and gender studies. But it worked out very well for me because it actually allowed me to move into other overlapping spaces to look at medical sociology, kind of more public health scholarship as well, and the way that that intersected with gender. And then I've ended up at ANSIRH at UCSF, which is a really unique place. So we're all social scientists, but engage in a lot of multidisciplinary work. So there's demographers, epidemiologists, public health scholars, physicians, and of course, a few sociologists. And it's a great place to work to really bring together different ways of looking at abortion access and reproductive health in the United States. So I feel lucky that I ended up in sociology. It allowed me to explore questions a lot more flexibly than I think other disciplines might have. And I feel very, very lucky that I've ended up at ANSIRH, where it allows me to work with colleagues across disciplines to look at the same questions. I always say, in retrospect, I knew very, very little about adoption when I started this project. I didn't have an agenda. I didn't have these criticisms that I was looking for when I started these interviews. All of the conclusions that I get to in the book and in these conversations come out of the experiences that people shared with me, which is what scholarship is supposed to be.
One way to think about what might happen with adoption today after Dobbs is to look back to a time when there was much more restricted access to abortion. Roughly the period from 1945 to 1973 is called the baby scoop era. And that refers to a time when there were really high rates of adoption in the United States, in Canada, Australia, the United Kingdom. But a lot of the work that we're talking about today focuses on the United States. And there were a couple of features of that time. So there was a lot of shame and stigma toward unwed mothers. There were less legal rights overall for women. And the prevailing way of dealing with unwed pregnancy was to send people to these maternity homes where they were often pressured to relinquish their babies for adoption. And that led to really high rates of adoption during this era.
And so Gretchen did some work around the baby scoop era and wrote some about that. And she talks about that a little bit. Gretchen also references the Turnaway study, which is a study that we know and love. The primary investigator was Dr. Diana Green Foster, who we've had on the show. You should check out her episode. But the Turnaway study is very unique in that it follows people who were turned away from care and looked at what happened in their lives. And Gretchen was really able to frame some of that data and help understand that data better as an adoption expert.
So my first study on adoption was part of my dissertation at graduate school. So I had already done that study that was qualitative, that interviewed birth mothers going back to the baby scoop era before Roe v. Wade. So I had that piece. I had published an article out of that data. And the Turnaway data collection was almost wrapped by the time I joined ANSIRH. But Diana Foster, she had this question of how adoption intersected with how people were making decisions after they were denied access to abortion care. And I write in the book that, what we found was that 91% of women who were denied access to the abortions they wanted were parenting the children to whom they gave birth, and only 9% were relinquishing. And Diana looked at this 9% and felt it was very low, right? 100% of these women did not want to have children. So why were 91% of them now parenting? And I look at the 9% and think it's astronomical because I'm comparing it to the 0.5% of the overall population. And I think both of these things are true at the same time, which is that adoption remains the least preferred path, regardless of options that are available. But you can also meaningfully increase adoption if you remove those other choices.
Yeah, I mean, that's one thing that stood out to me when I was reading your book is just the low total numbers per year of people who relinquish their children. Around 19,000 is what you had quoted in the book. And I think in my mind, I was imagining that it would be a much higher number, partly because there's so many people in my life that have been impacted by adoption, whether either being adopted themselves or family members that have adopted kids. I feel like it's just, and maybe it's just more, I don't know.
Yeah, the numbers are interesting. And I think we have the sense that adoption is much more common than it is, or that relinquishment particularly is much more common than it is, because everybody knows someone who's adopted, right? Everybody has someone in their broader family, if not their immediate family, who's been impacted by this. But I do want to clarify this 19,000, and I should say it's really It really varies based on the birth rate. It's about half of 1% of the overall birth rate. So the most recent data from the National Council for Adoption had the domestic infant adoption relinquishment rate at about 25,000, but that was because the birth rate had gone up. So it's going to be around the 20,000 range. It will go up in years when the overall birth rate goes up. It'll go down when the overall birth rate goes down. We don't have to your question of like, how does this vary regionally or by state? We do not have high enough quality data to look at that. I wish we did. We don't have any federal tracking for the number of adoptions. So these are all estimates. It is deeply frustrating to me as a researcher because I would love to look at the intersection of relinquishment rates and state level policies, right? How does relinquishment vary by different social service programs that are available, by different abortion bans or policies that are in effect? We cannot really look at that in a meaningful way because we simply don't have high enough quality data around adoption. But when you look at countries with more robust social safety nets, so Iceland, for example, which obviously has many, many fewer people than the United States, but they have like single digits, truly fewer than 10 domestic relinquishments. And even controlled for population, that is a fraction of what we have in the United States. When you look at Denmark, when you look at, other countries in Western Europe, particularly Scandinavia, where they have really strong social programs, you just don't see women from those countries relinquishing their children. That doesn't mean that adoption doesn't exist in those places. It just means that Danish women aren't relinquishing. But if there's a demand for adoption, which there is, most of the adoption market in these countries is transnational. So there have been a lot of adopted people brought in to Denmark, for example, from Korea, from China, from the same countries that have exported children to the United States. That still happens in these places. But it's simply that women from those countries aren't relinquishing at the same levels that American women are.
It also strikes me that their abortion policies may be different and that there may be variation in those abortion policies. I mean, some of them would be even more restrictive than the U.S. Some of that's a myth about what abortion is available in European countries. But I'm curious whether you can talk about the connection between abortion and relinquishment and sort of internationally.
I mean, I think actually the answer is that abortion policy impacts adoption rates much less than we think it should, because the connection between adoption and abortion is stronger rhetorically than it is actually. And what we find is that most mothers who relinquish their children did not try to get an abortion. They continue their pregnancies because they want to parent. And so it's the factors that make parenting more untenable that are more likely to shape relinquishment decisions than the availability of abortion. That is a meaningful proportion of relinquishments are because of abortion denials, but not most of them. I would say less than 20%.
We want to flash back to the Supreme Court arguments for the Dobbs versus Jackson Women's Health Organization. Justice Amy Coney Barrett talks about adoption as an alternative. She essentially asks, what's the big deal about continuing a pregnancy for another 15 or 16 weeks? Let's listen along.
It doesn't seem to me to follow that pregnancy and then parenthood are all part of the same burden. And so it seems to me that the choice more focused would be between, say, the ability to get an abortion at 23 weeks or the state requiring the woman to go 15, 16 weeks more and then terminate parental rights at the conclusion. Why didn't you address the safe haven laws and why don't they matter?
We were listening to the oral arguments. I'm on the West Coast, so it was early in the morning. And hearing her frame the lack of need for abortion because of the availability of relinquishment and termination of parental rights, acting like that is a meaningful alternative for people. What I felt mostly hearing her was an urgency, because I knew deeply that my research participants had something to say in response to what she was arguing, that they had their whole lives had been shaped by this decision that she was talking about as so self-evident and so easy. One of her arguments was that you can be unburdened by motherhood by relinquishing. And none of my participants felt unburdened by their relinquishments. They were all deeply engaged in mothering in different ways, emotionally, mentally, sometimes logistically still. And it was how they were negotiating that forever that was really the defining part of their experience. But what drives adoption is primarily the unavailability of parenting more than it is the illegality of abortion.
I feel like one of the common themes in the book is just the grief that people experience when they relinquish a child. And I think you talk about how many of the stories that we hear in the media or people talking about adoption in a positive light are often from families who are adopting children who have a positive experience. The missing piece, which your book shows us, is that people experience profound grief when they relinquish a child.
Yes, and in one way, that is counterintuitive because we are so reliably surrounded by these happy ending stories about adoption. But on another sense, it's completely intuitive to say that women don't really want to give their children away if they have another choice, and that it prompts a lot of mourning and grief when they have to. I think a lot of people can understand that on a pretty visceral level, the idea that these separations are not really what women would prefer, and that leads to pretty profound sadness and trauma for many of them. And I think that's part of what I wanted to capture with the stories that I shared in the book.
So in our state-mandated counseling, it does include mention of adoption. And let me read you that line. I understand alternatives to abortion include carrying the pregnancy to term and either keeping the infant myself or placing the infant for adoption.
They have to initial each line. We have to read it in person. They have to have an ultrasound the same day.
It feels pretty insensitive to read that at any time, but I think in particular for those patients who are having abortions in the setting of a wanted pregnancy, it feels very insensitive to read that. And there's a lot of problems with that counseling. However, I will say that I think that when we teach residents to do options counseling, the options that we talk about are continuing the pregnancy and having an abortion, and oftentimes that teaching includes adoption. Your book made me rethink how we should be doing that counseling, and then also reinforced my discomfort with this state-mandated counseling.
Women know adoption exists. Women who are seeking abortion care are not interested in adoption. So as part of Turn Away, all of the people who were able to get their abortions were asked before the abortion if they were interested in adoption. 0% said yes. 1% said kind of. But 99% said no, they're just not interested. They don't want to be pregnant. It's pretty rare that you're going to get a patient who wants to learn more about adoption. You don't need to become an expert on this, but you should have a comfortable place to refer people if they are asking about this. What does ethical care actually look like? Because so many adoption agencies are not secular, do not offer options counseling, do not engage in concurrent parenting planning, do not necessarily represent the legal realities of openness after termination of parental rights, do not offer pregnant people and new mothers their own legal counsel. All of this varies by state as far as what they are required to do, but this is not the standard of practice for most adoption agencies or attorneys in the country. And so I think having at least one referral that you feel at least okay about is probably the most important thing that providers can do. And most adoption agencies are either directly or one step removed from the anti-abortion movement because they're affiliated under the same church, because they work with a crisis pregnancy center, because they are the same legal organization as a crisis pregnancy center. And I think that's really important for a lot of people in our movement to understand, is that you don't want to just be referring folks to the adoption agency, in the next town over because they dropped off a brochure in your waiting room 3 years ago. That it's actually worth taking a little bit of time to do some diligence there and make sure that you feel good about where you're sending people.
mean, you talk about the significant disparities in kind of the adopting families versus the birth mothers that are relinquishing their children. And I'm curious if you could talk about that a little bit.
Yeah. So poverty is really the defining characteristic of most relinquishing mothers. This is different. So when you look back at adoption before Roe v. Wade, and really even after that, like through the 80s into the early 90s, the mothers who were relinquishing were young women, girls, white girls from middle-class families for whom being pregnant without being married was considered very disruptive to their life course. And so before Roe v. Wade, these were the girls that were sent away to maternity homes for these coerced, secretive adoptions where they were not given any control, any choice. And that's really what you saw. And that continued to some extent even after the Roe decision, but really faded both as legal abortion access expanded, but more importantly, as norms around single motherhood changed, and that path became more accessible for a lot of women. But the reason that this was disproportionately middle-class girls is because, and certainly white women and girls, was because the market demand was for white babies. There wasn't a lot of interest in adopting babies of color. That has changed now. And so you increasingly see that, again, poverty as the defining characteristic leading to relinquishment. So the majority of mothers who are relinquishing have less than $5,000 of annual personal income. Now, this is personal income. So if they are young and still living with their own parents, if they have a partner, they might be living a more middle class or at least, working class lifestyle, but that's not money that they have control over, right? They don't have resources to shape their own circumstances. And this is in contrast to adoptive families that are usually solid middle class to affluent, far more resources.
I heard you speak at some point about adoptive parents receiving tax credits for adopting, and there's some policy around that, and thinking about how that amount of money could have been enough for the relinquishing parent to maintain parenthood, and that definitely struck a chord.
Yeah, so first, a lot of states have adoption tax credits. Most states only apply those adoption tax credits to adoptions from foster care, which is its own problem, but it doesn't generally apply to the private system to the same degree. But the federal adoption tax credit does. And it is $17,000 per adoption, $5,000 of which is refundable tax credit, so regardless of other tax liabilities. If you had given any of my participants $17,000 tax credit, most of them didn't have tax liability, but if you had made any comparable level of investment, they would have been raising their children. It's not even a question. Most of them needed $5,000 or less in order to feel like they had a path that would make parenting possible. And that's, some people push back on oh, that's not really enough money to raise a child. They're not trying to figure out how much money they need to raise a child. They're not trying to get from A to Z. They're trying to get from A to B. They're trying to get from the apartment that they share with their abusive boyfriend to a safe apartment. They're trying to move out of their parents' home because their parent is not supportive of them having this child. They are trying to buy a car so that they can get to work and get to daycare. They're trying to afford a car seat and a crib so that they can feel like they have kind of the basics that they need to make space in their life for their child. So the $17,000 tax credit, again, $5,000 refundable right now for 2026, is a huge investment in these families that already have far more material resources available to them than to families that are vulnerable to separation. Adoption has really always been about the transfer of children from families with less power to families with more power. And in the United States today, that power is usually about monetary resources and class difference.
I mean, you talk about how some of the birth mothers have like sort of this fantasy of like the lives that their kids will have. Like they're kind of looking in this like, it's like a wish book of like, okay, these are the parents, these are, what they're like, what they're about. And I wonder if you could talk a little bit about kind of how people are kind of making decisions, because there were some interesting ways that people made decisions about who would be the adoptive parents.
Yes. So the Dear Birth Mother profiles, and actually my colleague Jessica Harrison and I just did an analysis really looking at these letters, because what's interesting is how uniform they are across the country, whether you're talking about prospective single parents, a heterosexual married couple, a gay married couple. You see a lot of really homogeneity in how people are portraying themselves to mothers. So you see an overwhelming percent of this person is going to be a stay-at-home mom as soon as the adoption is finalized. Here are pictures of our beautiful home, usually a suburban home. Here are pictures of us walking to the farmer's market down the street. Here are pictures of us going to Disney World with our nieces and nephews, or going skiing, or going to the beach, on our regular family vacations. Here are our own parents who can't wait to be grandparents. And what all of these letters, as an expectant mother, is considering adoption and looking through these portfolios, looking through these letters, you have to remember what has brought her to this point. She is there because she probably has very little money. She probably does not have a dependable partner. Some of them did, but most of them did not have a partner that they wanted to co-parent with. Her own parents and her own extended family are probably not offering a lot of support for her parenting. And so seeing, these beautiful homes, these wedding pictures, these excited grandparents to be, these are speaking all like directly to the key reasons that mothers are feeling vulnerable and alone. And some of the women I interviewed felt kind of infatuated with their child's adoptive parents in a way. And this was a really important part of it, because falling in love with their child's adoptive parents in this sort of manufactured way made it so that they felt quite obligated to go through with the adoption. They couldn't let these people down. They loved them. And, some of the mothers that I interviewed talked about feeling like the prospective adoptive mom was like their own big sister, and she really cared about them. And, they felt so alone in their pregnancy until the adoptive family kind of stepped in and would offer them support and love and care and tell them that they had something of immense value for these people who otherwise might seem to have everything from where the expectant mother was coming. And I think that's really crucial. And this is where pre-birth matching gets very complicated, because I believe if you want to have an effective open adoption, a strong enough relationship that you can stay connected after the finalization of the adoption, that some of that needs to happen before the child is born. But on the other hand, pre-birth matching does confer a tremendous sense of obligation to deliver the child. And a lot of that changes once the adoption is finalized.
One thing that I thought was striking in the book is you talk about how when birth mothers are signing the paperwork, that many of them don't recall that moment, like as they're thinking back on the experience.
I think they're traumatized. They're able to tell me with great detail experiences that they had during their pregnancy and experiences that they had after the adoption. But like a remarkably high proportion of the women I interviewed could not remember signing the papers, just couldn't remember it, or had very, very hazy details, or they might know where they signed, or they might, because sometimes in some states you're not allowed to sign the papers in the hospital. So there were a couple of mothers who would go and they would have to leave the hospital against medical advice, and they would have to go across the street to sign the papers in a parking lot across the street. So they would remember doing that. They would remember because then they'd have to come back and then sign themselves back in, right? They'd have to sign a paper to say they were leaving the hospital, even though their doctors were advising them not yet to leave, even though they planned to come right back. And so they're like, I know I did that. Like, I know we borrowed a wheelchair, and because I was only, 12 hours after my C-section, and I went across the street to sign these papers. And I know I came back. Like, they're aware that they did these things. They're not saying they didn't sign the papers, but they just don't have like very crisp memories of doing it. There's a lot of messaging out there that really centers the primacy of the adoptive family. And, many of the mothers I interviewed talked about, providers asking the prospective, because there's still prospective adoptive parents, asking them if they wanted to circumcise, asking them if they wanted these vaccines, working with them to schedule their first pediatrician appointment, all of those pieces. And what that does is it really just sidelines the birth mother immediately while she is still that child's legal mother. And so that is something that if this comes up, that providers can be really aware of. And I'm painting with a broad brush here, but I haven't found most adoption agencies to be deeply concerned about the ethics of their interactions with patients. Signing termination of parental rights before the baby is born and then post-dating it. That's illegal. They would lie to mothers, and this gets into the paternal rights, which are complicated. If a father was disinclined to sign, agencies might counsel the mother to say she didn't know who the father was, or to say she had been sexually assaulted so that they wouldn't need to engage with the question of paternal rights. This was particularly true. I had a very small number, but in cases where the baby's father was a Native tribal member, because that would trigger the involvement of the Indian Child Welfare Act. And so basically any case in which ICWA could have been invoked, it wasn't in the stories that I collected, because the agencies basically told the mothers it didn't apply, it wouldn't apply, it couldn't apply. Oh, if that's the case, let's just say we don't know who the baby's father is so that we can avert the need to involve the tribal authorities.
But I would think that adoptive families probably are concerned about the ethics and are concerned about the circumstances. And I think of in my own life, people who I know who have adopted, who are deeply ethical people and caring people.
I always say my book is about a system. And you can be a very ethical person and participate in a deeply flawed and unethical system. And I don't believe that improves the system, but I also don't believe that it immediately condemns everyone who participates in it if they truly don't understand the way that it's working. Many adoptive parents are very receptive to this research for exactly the reason that you say, that they are good and ethical people, that they care deeply about their child's family of origin, but mostly because they care about their child. And what I have always said as someone who has adopted people in my extended family, like almost everyone, a willingness to be critical of adoption doesn't mean that you don't care about the adopted people in your life. In fact, I believe a willingness to confront the unethical practices, the commodification of children, the premise of inequity that are really at the core of adoption, that is how you can love an adopted person. That wanting to understand what happened to them and how we can move towards justice is a way of loving that person too. And I think a lot of adoptive parents are there as well, because they see firsthand how complicated this can be for the people in their immediate family. And they want their child to have an identity of themselves that reconciles the family that they came from and the family that they're being raised in, because they want their child to have that sense of connection, because they want their child to feel open and comfortable with all of those parts of their identity, and that being able to give range to a wide complexity of emotions and experiences cannot happen unless you're willing to look at how the system currently functions.
What changes should adoptive parents or prospective adoptive parents advocate for to help make the system work better for them and make it more ethical?
I don't have a lot of clear answers for people who want to adopt, except that I think that you owe yourselves and you owe your potential future child your own willingness to engage deeply with these questions, because that's what parenthood is. Part of addressing the injustices in the system is in reducing demand, because you have these players that are incentivized to separate babies from their mothers. Because most couples who adopt want to conceive, try to get pregnant before they turn to adoption, we should actually give them more paths to do so, right? To make sure that infertility treatments are accessible, affordable, covered by insurance, to educate people more about their fertility and how it changes earlier in their lives. If we made sex education not just about, scaring young people about pregnancy, if we made it about actually understanding how your body works, how fertility changes, how to be prepared for those things, then we could potentially reduce some of that demand. And anything that reduces the demand for adoption is likely to then release some of the pressure and the profit incentives that follow. We always need more people to want to care for children, even if we don't necessarily need more people to adopt through the private system. So if we could value types of caring for children, types of relationships with children that aren't necessarily about parenting, now we're talking about a very broad cultural shift in how we think about the value of connections between children and their biological families. What does it mean to keep children in broader kinship systems in their own communities to find care without legally severing their relationship to their family and to their birth parents? But we have such a narrow idea of what family can be that we really try to recreate it by whatever means possible, even for people who can't conceive because of biology or circumstance. And so I think that part of this is shifting how we think about fertility, how we think about care, how we think about different ways that adults want to have caring relationships with children and what that means. To even talk about having a more ethical system, you have to have a credible social safety net. You have to have parenting be available for people, and you have to have people have real access to reproductive health care so that they have the autonomy to make choices about what they want for their lives. If we actually want to talk about what ethical systems look like, we have to provide reproductive autonomy and we have to provide care for people in their family of origin. Then, given all that, what does ethical adoption look like if we are assuming we have all these other pieces? You have to have providers that are nonprofit. You have to have providers, I think, that are secular or are at least willing to operate outside of their religious contexts for the purposes of counseling, for the purposes of referring, so that they don't feel a religious or moral calling to facilitate that. You have to reduce or eliminate the profit incentives at the core, even for nonprofit agencies. We have to ban for-profit brokers advertising in this space. We've done that here in California. So if you are not a licensed child placing agency, you are no longer allowed to advertise adoption services, which people in a lot of states are still doing. They're sort of providing these for-profit matchmaking services. So there are a lot of different ways to get at this from both a reform perspective and an abolitionist perspective that, addresses some of the root causes and inequities here.
There was one quote that I pulled from the book from one of the participants, Erica, and she said, "I just wish that adoptive families would understand that their happiness and their joy and their life in this child, there's another woman who has grief in that. And how do you balance that juxtaposition?" I found her story to be really compelling, and I'm curious if there were any stories that stood out to you amongst the folks you talked to.
I think the story that I I use it to anchor one of the chapters, and it's the one that I go back to the most because it was in doing that interview that I had pretty immediate clarity around what the book needed to be. It was this young woman, Leah, who I interviewed. I always say she's a young woman. She's only a few years younger than me, but I first interviewed her in 2010. They just celebrated her son's first birthday. And she was so optimistic and so effusive and so bubbly in talking about the adoption and how excited she was, how much she loved her son's adoptive parents, how every adoption should look like hers. And then when I interviewed her 10 years later, I said, "You said every adoption should look like yours." And she just sighed and she said, "Yeah, that sounds like something I would have said." She said, "I just really believe this adoption didn't need to happen." And her whole way, I thought I had the wrong number when I called her the first time because I had just listened to our first interview again, and she was just so effusive and so excited to talk about the adoption. And in our second call, very flat tone, flat affect, and what that contrast in who she had been and who she was in our second conversation, and hearing her talk about the challenges of navigating openness with her child and her ongoing, longing for him in her life, her feelings of frustration with his adoptive parents for some of the ways that they were raising him that she couldn't do anything about, right? I think these were real struggles that she was grappling with every day. And doing that interview and reflecting on her story just made me realize the extent to which, one, this is a lifelong journey. So the idea of terminating your parental rights just averts the burden of motherhood, as Justice Coney Barrett said, there's no relevance to Leah's life, right? She is dealing with the burden of motherhood in a very real way on a very regular basis. But it also just showed that even for someone who was feeling so positively, so hopefully about the adoption early on, how little was done to care for her over those 10 years, and how much disregard this system that she had put so much into really cared about her, this disregard with which they treated her, that her value was in giving this child to another family. And once that was done, she didn't have this support around her anymore. She wasn't valued for her motherhood. She wasn't really valued as a person in her child's life, right? The parents kind of viewed openness as a favor to her. And her story's not alone, right? I heard this refrain over and over. But the change in who she was and how she talked and how she understood what had happened to her during her pregnancy was just so stark. And I do think about her story very often. I think about all my participants very often. They shared real vulnerabilities with me, and it's a real honor as a scholar to get to help share those stories.
Opinions expressed on this podcast are our own. Philanthropy keeps this podcast ad-free, and you can make a tax-free donation at the link in the show notes.
This podcast is executive produced by us, Dr. Bev Gray, Dr. Jonas Swartz, and Stevie Manning. Thanks to Nick Thorburn, Patrick Ford, and Maker for our score. Extra special thanks to Gretchen Sisson for lending her voice and knowledge to the show today.
Feel free to email us at outlawedpodcast@gmail.com with any ideas or feedback.
And subscribe to our Substack, outlawed.substack.com.